Afternoon. My name is Wendy Randall. I'm one of the consultant midwives at the John Radcliffe Hospital. I'm sorry I'm a little bit late for our session today. I see I'm about 5 minutes late. I do apologise, and we will wait to see if anybody joins us today. I hope you are enjoying the sunshine. It is very warm here in the hospital. And I have just been talking to someone in my clinic today about what it's like in the birthing environment and on the ward, and can confirm it is very warm. Like we did last year during the heat wave, we very much said to people, bringing in bottles of cold, frozen water can help. Don't bring in massive cool boxes, but if you have one of those small cool boxes and you want to bring in some iced water, you may find that helpful. I'm not quite sure where the setup is with the fans at the minute, but the COVID rules were that we didn't use fans because obviously it had the potential to blow the virus around the unit. Please be aware we are an old 1970s building. We don't have air conditioning. We do have windows, obviously, which will be open, but there's not very much air about just now. If anybody had the kind of night I had trying to sleep last night, it makes it a little bit more difficult. This is the 19th of July and the date that we've all been working towards, and what that means in terms of everyday life. I trust that you have seen the post that was Maternity Voices Partnership posted last night about the potential changes in the unit, and I can confirm that partners can stay longer on the postnatal ward. Visiting is now from, I think it's 8 till 8. That is just your birth partner. It isn't about changing who comes to visit, but apart from that, we haven't made any other changes, and we're asking you please to still wear your face mask. I don't have my face mask on just now because I'm in my office and there's just me, but I do wear my face mask when I go outside my office and when anybody comes into my office. So we do ask people to still be careful. I know the government have said that it is optional, but please do look after yourselves and others. We would still recommend that you wore it in public transport, in shops, etc. We're trying to keep everybody as safe as possible, but I'm sure you're aware that the rates in Oxford are quite high, and especially in your age group, because the older people are being vaccinated. So hopefully you've had the opportunity to access our films on vaccination, and are considering having that done if you haven't had that done already. So we are recommending it for yourselves and for your partners, etc., to try to enable us to get through the next part of this pandemic. I don't know if anybody has any questions for me today. I have. Let's have a look. So Pamela, you said you've had your 36-week point. You have your 36-week point next week, but it's not very clear to me and my partner if I need a lateral flow test to go in, or is that until I go into labour? So we are asking you to do lateral flow tests, Pamela, you and your partner, when you come into the hospital setting for any of your appointments. So as part of your antenatal pathway, please do use the lateral flow test. Gemma, you're 38 weeks and your baby is breech and you're keen to opt for a vaginal breech birth. Is there something I will be supported to do as long as the signs, that is position, etc. is safe to do so? So yes, Gemma, I hope that you've had the opportunity to attend our clinic that we have. We have a breech clinic that I think is on a Tuesday now. It has fluctuated between a Monday and Tuesday, and they will go through that with you to tell you how best they can support you. But it sounds like you have the right information. We want to look at what position baby's in, how curled up baby is, which are all quite relevant. So going through the questions, Alexandra, you've said, how would you advise we can keep a newborn cool in the weather? I think the really important thing is to be aware of the temperature, to not have the baby in direct sunlight. You can feel baby's temperature either down their front, down their back. Be aware that you don't need lots of layers, but obviously don't leave baby in nappy under direct sunlight. And just feeding, if you're breastfeeding baby, then please do continue to breastfeed baby as baby demands it, because that will quench their thirst. And do look for advice. It's a really good question to go into more detail with the infant feeding team on a Thursday. But generally it is, if your baby is wanting to have formula milk or breast milk, then responsive feeding is about doing that. I don't think we advocate giving cold boiled water to baby, but please do check that with the infant feeding team, because these bits of advice do change over the years. And they are absolutely the expert on it. But I think the main things are making sure that baby, obviously you don't want to sit baby in a draft, but make sure that where they are is well ventilated, and baby doesn't have too many layers on, are the main things. So keep an eye on your room thermometer for where the baby's based as well. Kimberly, you said, do you need to pack anything extra on your hospital bag if you're hoping for water birth? So Kimberly, some people are happy to be in the birthing pool naked. Other people would like to wear things. If you would like to wear things, you can bring in a bikini top, or a light t-shirt. Swimming wear tends to be better in terms of bikini top or tankini top, because you don't cool down as much as you do if you're wearing a t-shirt. But yes, if you want to pack something like that in, but you don't have to. Some people just wear their normal bra, and if you're fine to do that too, that's okay. It's just obviously bring in a change from that. So I hope that answers your question. Emma, you are 25 weeks and concerned about whether to get the vaccine or not. You're planning to wait until after the birth, but cases are high, which is a concern. You're worried about the long-term effects on the baby and their development. So Emma, we did record some films about that. They're available on our website. Miss Kelly provided some further information. There's the Royal College of Obstetricians and Gynecologists have a leaflet as well that your community midwife can direct you to. Generally, we are advising people to get the vaccination, because although the risk of you becoming unwell with COVID is low, it does actually, it can make pregnant women quite poorly, especially in the third trimester. So I appreciate people have said, well, before you were saying, maybe you shouldn't and wait until after the baby's born, and now you're changing your mind. But I suppose they've looked at the evidence, what evidence we have that's developed over the period of time that we've in this pandemic, which enables us to be able to recommend it for somebody to have one. So we do recommend following that up and arranging that for you. Emma, you were wondering whether having the flu jab and COVID jab around similar times is something to think about. Thanks. So Emma, I think in terms of the vaccines, my understanding is that they're not giving the flu jab and the COVID jab at exactly the same time, but again, that's an evolving picture as well, and having some staggering time between them. But your GP is one of the best people to go through that with you, so it might be worth talking to them about it. Or if you sign up for the COVID jab, which is obviously what we'd be recommending now, because flu season's later and starts in October, is you can have that conversation with the vaccinators as well. Zoe, you've said, when would I expect my community midwife to refer me to you to discuss being induced and or how I'll give birth? You were induced with your second at 38 weeks due to your first being large and also traumatic birth. So Amy, your community midwife, if this was a plan, I think we did make it together. It was with myself. The community midwife will talk to you about what to do this time round. They'll talk about your second birth with you, and if they want my support, they will do a referral to me, and we can chat again about your plans for the birth of your baby. It's good to have some scans first, so Amy, because every baby is different, and to get that bigger picture of how baby is growing. Because you don't always have a bigger second baby. There'll obviously be people out there that say that babies are bigger second time round. You certainly look bigger second and subsequent times, but generally we won't. We look at how your baby's growing to get a fuller picture. Pamela, you said after you gave birth you understand that your partner cannot stay with me overnight. Will you need a lateral flow test to go back the next morning? Just want to plan accordingly. What a good question. I guess I'm going to have to find that one out, Pamela, because if he's had a lateral flow test the day before, then I'm not going to guess that one. I'm going to ask that, Pamela, and I will get MVP to post something about that. But unfortunately your partner can't stay overnight with you in the hospital, so we have just managed to extend that time up to 12 hours, which is a big difference from what we've had before. But unless in incredibly exceptional circumstances, then partners can't stay overnight. And I think that's all the questions. Thank you for your smiley face, Kimberly. So yeah, I think maybe the main messages for me for today were just to say there's an awareness over the postnatal visiting, to please encourage you to think about space, hand washing, face masks. They're all still incredibly important, and to consider getting the vaccination. Yeah, thank you, Zoe, Amy. You've given me some more background, and yes, we speak to your community midwife, and she'll sort out time for us to chat again this time round. And Pamela, I'm pleased that information was helpful for you, and I will get that information to you. I'm going to write myself a note about the lateral flow test each day. Be somebody out there going, of course Wendy it's this, or of course it's that, but I'm sorry, I think I'm still in holiday mode, my first day back after being off for a week, but I will check that over for you and make sure that you get that information. So I feel like I've done a whistle-stop tour today. I don't think I've ever been on and off again in 13 minutes. If there isn't any other burning questions, I will leave you today and go back to my clinic. So again, just remember to think cool. Think about ways, if you're coming into the hospital, to keep yourself cool. Partner wearing layers. Think about bringing in some bottles of iced water, to try and help you with that. Yes, just to try and stay safe as much as possible. Kate, you were classed as high risk at your 20-week scan. However, the issues have sorted itself out, and all scans since have been well. You've not heard of a consultant, and community isn't sure. You're 37 weeks. So, Kate, I would suggest that you contact your community midwife, and she can consider. She can consider what the risk is, whether it was something that we've screened for since that has passed, if it's something to do with Dopplers, that would depend what the measurement is. So I would phone up your community midwife and ask, and if she requires any information from myself or one of the other two consultant midwives, then we'll get an answer back for you. We want to obviously help you with make the plans for your birth of your baby. Lisa, you've just been diagnosed with obstetric cholestasis. Wearing face masks now causing my itchy worse on my skin. Is there a possibility you could be exempt, and who would you need to talk to? Yes, Lisa, is it better if you use a cloth mask rather than a hospital mask? You know, it is something that you know, we're quite keen for people to be able to do, especially when you're walking about the hospital. So I think probably have a chat with your midwife, see what you're currently using, whether she can suggest an alternative. We just want to try and keep everybody as safe and well as possible. There might be some barrier cream if it's across here where the mask is that's itchy, or around there, that might help you with that. So do speak to your midwife or GP about that. So Fiona, you spoke to Birth Afterthoughts 3 weeks ago and haven't received an appointment yet. Should you call back? Yes, I think it would be worth leaving a message again for them. They do have some admin support now as well. And if you haven't heard anything in the next few days, if you'd like to message Maternity Voices, they will send a message to me, so that we can follow up on that for you, to make sure that you get that appointment. So the last time I said I was going to go, I got a little flurry of questions, so I'll just hold on another minute to make sure that I've answered all of them. If you're not sure, like I said, we have the infant feeding team are on every Thursday afternoon, so please do talk to them about sort of feeding and supporting babies in hot weather. I will get the question about the lateral flow test. I'll get the information and send it to you. Yeah, anything, you know, please do reach out to your GP about vaccinations. Please reach out to your community midwives about other issues. So I'm going to leave you today, and I hope you are all well. Stay safe, everyone, and hopefully everybody won't go too mad out there. Oh, Jodie's just snuck in for a question. I was just about to press stop. Jodie, do you know if there are any plans to review the number of birthing partners allowed in the hospital or MLU setting anytime soon? You understand that this isn't changed as of today, and is still only one birthing partner allowed. So Jodie, I think you know, what we're trying to do is keep an eye on the Oxford levels. So I know our director of midwifery and our clinical director, who's a consultant obstetrician, work very closely with infection control and the rest of the trust, and they're reviewing the situation the whole time to see what's happening. I think we need to watch this space and see what's going to happen. I know there are people that feel it's the 19th of July and everything is all over, but so it will depend how infection rates are. So we do have to, you know, when I'm making a big fuss about asking people to get vaccinated, you know, keeping masks on, it is to try and keep us all as safe as possible, to keep us at work as well. So, you know, the less people we have contact with, almost the better, as for you all. You know, that's why we haven't changed it yet. But I think we will update. We've been working so closely with Maternity Voices Partnership. They're an amazing resource that we've been able to, you know, provide all these lives with, and given us lots of support. So they send me messages if you send them for questions that you want answered, and we update them. I speak to the chair every week and update if there are you know, any changes in terms of visiting. So we will absolutely keep you up to date as soon as we know what's happening. So Hannah, yes, you've asked a similar question about a 2-week-old, and you're worried about the heat. Is there anything you can recommend to keep him safe? So keep baby hydrated. If you're breastfeeding, continue to breastfeed. Baby will take as much as they want. Demand feeding with bottle feeding is the same. And you know, just in a nappy, not in direct sunlight. You don't want to burn baby's skin. My office is just along from the infant feeding team. I'll see if there's anything particular they can possibly, that we could post to reassure you all, hopefully, but otherwise join in their session on Thursday. But be aware that you are probably drinking more yourself. I've certainly gone through bottles of water already today, so do respond to baby and try to keep them cool. Breast milk colostrum will help to quench their thirst. So I'm going to go and speak to infant feeding team now. I'll get the answer to lateral flow tests, and we'll pop something up there for you so that we have the answers to your questions. Thank you very much, everyone. Take care.